Hey, so it's been a while. My apologies. What happened, which explains the title of this video, is that following my trauma rotation, I absolutely fell in love with surgery. And I think that's what I'm going to do. So I had a lot of things that I needed to reorganize in addition to, suddenly getting honors in surgery became kind of a big deal if that's what I want to do. So I've been studying and trying to be impressive on the wards and, all that kind of stuff. So I am in my last rotation on surgery right now. I'm in transplant surgery, which is actually how I have time to be making this video. In about 4 hours, I'm going to go on a donor run, go pick up a kidney. Which is exciting. It's just going to be me and an attending, and we're going to fly out in a helicopter and go take somebody's kidney out and bring it back to our hospital and put it in one of our patients. So that's exciting. I've been on transplant surgery for about a week and a half now, and this is the first time I've had the opportunity to go on a donor run, so I'm excited. But needless to say, I'm going to be up all night tonight, and so I'm taking it easy right now, and it was the perfect time to make an update on my situation. So yeah, I wasn't expecting to like surgery so much. I'd actually pretty effectively crossed it off my list after OB-GYN because I thought I didn't like being in the OR. Turns out I just don't like OB-GYN. And not only do I enjoy being in the OR, surgery is an amazing specialty. And I'll tell you why. I've liked pretty much everything I've done so far. But this is the first rotation where I actually feel like we fix stuff. And it's a pretty amazing experience carrying somebody all the way from being so sick or so injured that they needed to go to the OR and then having them up and walking around in a couple of days. And, on most surgical services, patients are discharged after a week at the most. So that's pretty awesome. So in addition to trauma surgery, I've done colorectal surgery, which actually was a blast, and cardiothoracic surgery, so like open heart surgeries and valve repairs and bypass grafts and that kind of stuff, which was also awesome. And now I'm on transplant surgery, which actually I'm not enjoying as much as my other rotations, but I've gotten to do a lot of stuff like this attending that I'm going with tonight, he let me stitch up the bowel on our last case, which nobody ever lets me touch anything that's important. And so the fact that he was willing to let me do that was amazing. And then, usually they just let med students close the skin because even though that's the only part the patient sees, if the skin opens, you just close it back up again. It's okay. As opposed to, the bowel, where if that's not stitched up right, it'll leak and make them septic. That patient did just fine, by the way. So, it's been a pretty exciting couple of months. I had to rearrange everything I was thinking for fourth year. I had to schedule a bunch of new rotations and get a new advisor and basically move a whole bunch of stuff around. So, and the rotation's a lot of work anyway, so, in the midst of all that, I also had to see all these extraneous people and get all that stuff situated, but it's pretty good to go at this point. The only thing that's remaining before I'm like 100% absolutely committed, this is what I'm doing, is the emergency medicine rotation, which if you've been following, emergency medicine is kind of what my idea has been. But, it was the idea just because I hadn't been grabbed by anything else. And it was like maybe the third call on trauma, they actually started letting us do some stuff, and it was so cool. And then, we had a couple of patients that came in so badly injured, and we fixed them. And they were fine, like they were up and walking in a day or two, and it's just stuff that you don't see on internal medicine. And internal medicine is a lot of trying to manage diabetes, and they never really get better, and you put in all this work to get somebody well again, and then they come back in 2 weeks, and it's really annoying. And yeah, it's a really good feeling to actually feel like you're doing something for people. In addition, you know, because patients actually feel better, they're a lot nicer to surgeons than they are to their internists, you know, because the thing about internal medicine, it's a partnership. And so if the patient goes home and eats a whole bunch of salt when you told them not to, and then they're going to be sick again, and then they're like, well, why didn't you do your job in the first place? Why am I sick again? And it's a vicious cycle. So, yeah, that's what's going on, and that's why I've been MIA. I've been trying to get everything organized. So what I'm going to try to do, my shelf is coming up. My post-rotation exam is coming up. But after, then that ends on June 17th is when I take that exam. It's a pretty big exam, and obviously we're getting pretty close to it. So after that, I do an additional 2 weeks of trauma because I need a letter of recommendation from one of the attendings on there. So since I don't have an exam coming up after those few weeks, I'm going to try to do a video on colorectal surgery, and then one about CT surgery, and then one about transplant surgery. And that's pretty much the plan for right now. So I just wanted to pop in and update and talk about what's going on a little bit, and then I'll get into specifics of each subspecialty that I've done so far when everything's settled down a little bit. Yeah, those 2 weeks after surgery, but before emergency medicine. I also have a bachelorette party right in the middle of that, so I'll do my best. But I'll have a lot of post-call days where I don't have to study, so it'll be good. So yeah, if anybody has any questions or comments or what have you, I've tried to respond to all the ones I could find, but actually Facebook. YouTube doesn't give me all the notifications all the time, so if there's something I missed, my apologies, it wasn't on purpose. And yeah, I'll be back in a couple of weeks once the surgery, OSCE and shelf are over. So I hope everybody's doing great, and I'll see you guys in a few weeks.